So my name is Manal Patel, and I've just completed my medical degree at St John's College at the University of Cambridge, and I'm going to be joining NDORMS as an academic foundation doctor come August. So the idea for the research project really originated on one of my placements at medical school at Hinchingbrook Hospital, where I met my supervisor, who's Mr. Anthony Barabbas, who's a consultant plastic and hand surgeon. We really just took an idea that came straight from the operating theatre, and it's known as the tendon turnover reconstruction technique for tendon repairs. And it allows a single stage repair without the need for a donor tendon from elsewhere in the body. And therefore you don't have a secondary donor site wound. And it's a really effective technique, but it hasn't yet been tested in terms of its biomechanical properties, and it hasn't been formalized into a classification system. And actually the best way for treating tendon injuries has previously been discussed as a priority for hand surgical research. And so with the support of the BSSH Research Fellowship, I really developed some vital skills in research at a relatively early stage, which I hope to take forward with me in my future career in surgery. It really meant taking a first principles approach in terms of, it meant taking a first principles approach to form an evidence basis for the effectiveness of this technique. And it's helped me to become equipped with the skills to take a hypothesis from a proof of concept pilot to planning a full-scale bench-side research project. I was able to write up a research proposal. I pitched the idea to various departments, and it involved multidisciplinary collaboration across both medicine and engineering. I've been very lucky to work with Prof Sutcliffe, who's head of the biomechanics group at the University of Cambridge, who I wouldn't have come across otherwise. And I became more confident in my ability to communicate ideas and justify the study to funding bodies, as well as, of course, writing a grant proposal, which are skills that are vital for any sort of future investigator. And in terms of output, we have some really interesting results, which I'm very grateful to be presenting at the upcoming BSSH conference in Oxford. And I'm really delighted to be sharing the results at this meeting, which is so fitting. And we're in the process of manuscript preparation. And there's a lot of scope to take this project forward into my future career, in terms of using patient-reported outcome measures to see how this technique behaves both at the bench side, which we've done, and with patients. And I wholeheartedly sort of recommend any budding researchers who have an idea for a project to apply for funding in this way through the BSSH, regardless of their stage of training or their level of experience, because you can do it even as a medical student. And I really believe that the research committee at the BSSH are fully focused on yourself and your development. And this is sort of reflected in the interim report, which I've produced, which really has a focus on what you've learned and how you've developed as a researcher as a result of taking on the project.